So it's really important, I think, especially in the African American community, where unfortunately things like diabetes, high blood pressure, asthma are extremely common, to be really aware that the coronavirus is not like the flu virus, and it's not like your common cold. It is something that, especially in the presence of diabetes and high blood pressure, can lead to really quick deterioration of your symptoms. And there's not always, unfortunately at this time, there's not always a treatment that can bring you out of that. I think sometimes we think, oh, if I get sick, I'll go to the hospital and they'll fix me. That's not been something that can happen with the coronavirus. You can't go to the hospital.
Please say that again, please.
They say life is what you make it. I'm a legend in the making. I know just what I'm made of.
I'm just saying. Woo, it's a beautiful day. As I tell you guys, every day right now seems like Friday to me. Well, I guess that's the power of COVID-19, huh? Every day seems like a weekend's coming, because I guess we don't really have a whole lot for some of us to do. So basically, I want to first do a shout out. I give a shout out for, as I always do. My shout out is going to first go out to Mari, who always makes sure that my social media is together and everybody knows where I am, from Instagram, Facebook, YouTube, all over. So I have to give that shout out. My show manager, Michelle King, keeps me in line, makes sure that everything is right, that I'm on point, because they know that I can go kind of off the rail and they pull me back in. Quan, homie Quan, big homie Quan, always let me know what's going on good in the wood. Quan has the show Accelerated Radio, The Takeover. So we are great, and I'm happy to have him always by my side. That's one co-host. Annika, Valet Code, always ready to give it to me straight, no chasing.
Here.
Make my throat itch. As I say, I don't know which side of the coin, but whatever side she on, that's where I want to be. And she always makes sure she brings us great information, informative information and news, which is what we're here for. Doing that, showing that love, I want to make sure that we also make sure that we acknowledge something really quick, because did y'all realize they let Paul Manafort out of jail?
Yes.
Yes.
Did y'all realize that? And before I get started, we are going to make sure that people know, and then we're going to have a disclaimer that I host. These are my co-hosts and my lovely guests. So whatever I say, no one has any control over what I say. This is not their opinions, their beliefs. They have nothing to do with it. I stand on my own strong, as my Andrew said, head up, you know what I mean? Ready to call out wrong.
In other words, warning.
Yes.
Deion Johnson's gonna say some shit.
Yeah, well, Deion Johnson gonna keep it real, because that's why it's called I'm Just Saying, because I be saying, I can say what some people can't say. Ain't nobody got me on no paycheck. Nobody. I'm not fearful. Ain't nothing you can do to me. I serve a higher God, and my life is in his hands. And if something were to happen, it's because it was already in the making. So basically, I'm going to speak truth. Now, why in the hell is Paul Manafort out of jail, but Bill Cosby ass still in jail? Why was Flynn not even charged, hadn't served one day, but Bill Cosby still in jail? Notice I ain't saying nothing about R. Kelly. But anyway. But I'm just keeping this real.
The R. Kelly argument, really? Okay, go ahead.
No, I would.
He is the king of R&B.
He need to be under jail in the musical. That's all I gotta say. It's a whole different ball game. We ain't talking about children. And with Bill Cosby, I'm still on the fence with this, because we were going at the time between sex, drugs, and rock and roll, but also he was really dating a lot of women, messing around with a lot of women. I think he just got caught being a player, and he pissed off some people. He thought he had white privilege. He didn't have a complexion for the protection. So when he said, NBC, I want to buy you, they said, we got something for you, my brother. You got the money, but you also got some history that we all know about, and we're going to bring it out. But the thing about this is, Cherie, when I say
Yes,
Cherie,
ma'am.
I call her Annika, but when I get serious, I say Cherie. When I want a serious answer, I say Cherie. Cherie,
Yes, ma'am.
as an attorney, for all the years that you have served, help me understand something. Is Trump lining up all the king's men? Are we going to have a repeat of what happened with Hillary? Because remember, all of them played the role when this happened with Hillary. Remember, it was Flynn, it was Manafort. All of these men put this together. So is he that worried about Joe Biden, since the ladies seem a little weak, that he bringing all his king's men together? Or are we so blinded by COVID-19, which we should be because life always matters, that he's getting all his dirty work done? Like, in case I lose, let me get all my partners out of jail.
I'm hoping it's the latter. It's the latter. I mean, COVID is certainly has got some winners and losers. And today we have a wonderful guest with us today, who's taken time from her enormously busy schedule, Dr. Mellissa Gier. She's on with us today, and she's going to talk about COVID-19 and the African-American community and in the area that she practices, and how it has been, my mantra is how it's been impacting healthcare practitioners like Dr. Gier, her practice, even the hospitals where she has privileges, and what words of advice she has for us, because we now know that Black people are not immune from COVID-19. Is that correct, Dr. Gier?
Yes, there's no human being who's immune to COVID-19 unless you already have immunity. And even that, there's not a lot of clarity around what it takes to be immune to COVID-19. Probably it'll take a vaccine, which is not available and will not soon be available. So nobody is immune to COVID-19. And it's important to keep in mind that the more comorbidities you have, things like high blood pressure and diabetes, these are diseases that are really common in African Americans. It puts you at greater risk for getting really sick from COVID-19. I'm from Michigan, and I really worry that the severity of the disease and how high the death toll was there in Detroit is due to like the large African American population. So I think it's really important to keep in mind that no one's immune from it. Nobody is immune to COVID-19. I think in California, we just haven't seen how out of control it can be. It's a really serious illness where people get really sick really quickly. I fortunately have not yet taken care of any patients who've gotten that sick from it, but I've talked to people who have, and it's just something we really should respect and try to follow the rules and do whatever we can to, make this process of this virus, this scourge, have as little an impact as possible. I hope that makes sense. What really frustrates me about the SARS-CoV-19 pandemic is how little is known about the coronavirus. Every 2 weeks, there's something new. I feel like the latest thing is that it affects children, whereas 8 weeks ago, children couldn't get it, and children were fine. And now children are starting to die from the coronavirus. There's just not very much that we know about it. So I think it's better to be on guard no matter who you are. If you're living on planet Earth, be on guard, because the coronavirus is a threat to all of us.
Okay, so real quick, because I noticed that Annika has a question, and only because you said the children, and I want to ask you something really quick. Do you think, and it's just a thought, with the children, when it first hit, remember they stopped school, they did everything and pulled the kids inside, and they put them away from each other, and they automatically, that was one of the first things, if I'm right, one of the first that they started, they were already out on spring break, this, that, and they just left them out. Now summer is coming, and everybody, because if I go in the store, when I do, because I try not to go because I do have issues, as Cherie does, and I see children. And for a while, I was seeing them without masks. You know what I mean? And I see more now, parents out with their kids, taking them for a walk, doing things, because it's warm. and they had been hearing that no kid had it. So my question to you is, do you think that now that everybody's trying to come out and they felt like the children were not at risk, maybe they really were, it's just that we were protecting them by keeping them in?
Gosh, I don't know that much, again, about the coronavirus because it's new, it's really poorly understood, and my biggest frustration has been how the rules around this virus seem to change every 2 weeks. It really is.
Welcome to the club, Dr. Gier.
But we're all in the same page. Like, we really are all getting the information at the same time. But what I understand about the children's version of the illness is that it's not the active infection itself that makes the kids sick. It's a delayed inflammatory response. So once they've healed from it, there's some remaining inflammation that happens on their blood vessels that leads to a blood vessel inflammation that can be life-threatening. Does that make sense? Whereas in adults, what happens is coronavirus typically causes death by starting with pneumonia in the lungs. With kids, it's not the respiratory infection directly that's the danger. It's the inflammatory response, or the body's response to the respiratory infection that is going on for weeks after the infection. So it's kind of a little bit delayed. So whereas, for us, we have this like idea that there's a 2-week period of time after infection where we're either going to get sick or we're not. So with kids, it's several weeks after the exposure that they're getting sick with this new inflammatory disease.
Okay, so you're basically saying,
Dr. Gier, can I ask you, you gave us a lot of knowledge in one big spiel, and I want to break it down a little bit. What do you mean by comorbidity? And what are the signs that we're looking for, at least for the next 2 weeks? What are we looking for in ourselves or our family members to keep ourselves safe? What are we looking for?
Okay. Comorbidity means medical problems, or let me put it another way. Anything that you are taking prescription medication for is a comorbidity, something that makes your physical response to any illness a little bit more challenging. That's why it's called a comorbidity. So if a person's been specifically treated for high blood pressure, that's a comorbidity, which is really common. Diabetes, those are going to be common disorders. But if in the past, you've had a struggle with cancer, if you're a cancer survivor, or you have really any medical problem, that's a comorbidity, or something that's going to be a risk factor for you having a more severe disease course if you get the coronavirus, versus, well, it'll lower your chances of being asymptomatic or only having a mild infection. So it's really important, I think, especially in the African American community, where unfortunately things like diabetes, high blood pressure, asthma are extremely common, to be really aware that the coronavirus is not like the flu virus, and it's not like your common cold. It is something that, especially in the presence of diabetes and high blood pressure, can lead to really quick deterioration of your symptoms. And there's not always, unfortunately at this time, there's not always a treatment that can bring you out of that. I think sometimes we think, oh, if I get sick, I'll go to the hospital and they'll fix me. That's not been something that can happen with the coronavirus. You can't go to the hospital.
Please say that again, please, because it was profound.
Yes.
I only ask you this, not because of, I'm being funny. I'm asking you this because I do, with some of the things that I'm seeing, and after seeing those young kids in Chicago with that party and all of them there, no mask, all I want you to do, because maybe they think, for real, and somewhere in those minds of people that out marching saying, I want to go back to the beach, make us free. Like they never know where they're meant to be locked down, which they probably didn't. But I want you to say this clearly again, because it was so profoundly said. Because I do think they think. Say it, Doc.
Okay, I'll try to say it just as well as I said it before. I think a lot of times people think it's okay if I get sick, I'll go to the hospital, they will fix me. That is not what happens with the coronavirus. When you get to the hospital, we can't fix you. You can't be fixed by being put on a ventilator. That doesn't fix everybody. In fact, more than half of the people will die who are on ventilators. It's not that you can get fixed. This is not something we know how to fix. So please just don't think that. Don't think that. I know I see patients a lot sometimes who think it doesn't matter what happens to me, you guys will fix me. I've seen people say that in terms of like pregnancy and the number of C-sections they have. And so I'm familiar with that way of thinking. And I could see how that could go on to the coronavirus, but never was there a disease we were so unprepared for as this. I know it's 2020. This is the disease that we've met our match with. We do not have ways to treat this. We have no way of treating this effectively to help you necessarily survive. Once you're so sick that you need help breathing, you're really sick, and there's it's 50-50. Okay, I hope that was clear.
Very clear. Guys, not talk to my panel, but people, she was clear. And I hope that your mind, brain, and it will expand, so when it goes through your ears, you'll understand what she was just saying. Now, if someone tells me something is not fixable, that tells me something. I would love to tell you that I am a gay Black woman because AIDS hit America. You know what I mean? And when they see it, how it could be transpired, I changed everything in my life. But the point is, that's how much fear I have of things when I felt like they didn't have a cure for something. But it did put a lot of weight on the scale. I'm just saying. It did.
You just saying.
I'm just saying. It
Dr.
did put so
Dr.
she's telling
Gier.
you something.
Dr. Gier, can you tell us about your medical background and your practice area, and why we should take what you just said, which I also agree with Ms. Dion there, is quite profound. More than 50% chance that if you get put on a ventilator, you're not going to come off of it still breathing. Okay, that's what Dr. Gier just said. So medical doctor Mellissa Gier, tell us a little bit about where you went to medical school, what type of medicine you practice, and how has COVID impacted your practice?
I should point out I am an OBGYN, which means I deliver babies and I do gynecology. So generally, I'm taking care of really healthy people. When I do hospitalist work, that's been the only time I've encountered COVID patients. And fortunately, I think just because California generally has so far not had as many cases as other parts of the country, I've generally been spared from seeing people, go down the drain. But I do OBGYN, so I deliver babies. What was the question?
Where did you go to medical school? How long have you been practicing medicine?
Thank you. I went to the University of Michigan in Ann Arbor, which is very interesting because I have discovered Instagram since this all began. I check Instagram to follow what the governor and the mayor say. And Michigan, as I was just mentioning, had a really difficult time with COVID. The cases of SARS at their hospital was much higher than we've seen here yet. I finished med school in 2001. I've been practicing here in Southern California. I did my residency at USC, and I've been practicing here in Pasadena ever since. Since the safer at home policies were put in place, I've started, and I think all physicians, just like all other businesses, except for grocery stores, have seen a decline in business. And
Really?
all physicians are seeing fewer patients. And to a certain extent, that's good. We don't want to have waiting rooms. Like if you think of a doctor's waiting room, typically you think of a room that's full of people and everybody's kind of sitting like that, shoulder to shoulder. That's the opposite of social distancing. You certainly don't want want that, especially when you're talking about people who are sick. But I think that there is certainly going to be fear among patients in terms of returning to their doctors. But typically, like, I think this has been a really good opportunity to start to explore different ways of delivering medicine. Physical exams are still going to be very important, but it's been really exciting for me to do, telemedicine.
What's telemedicine, Dr. Gier?
Telemedicine is when you meet with your doctor through some video chat like this, kind of like what I'm doing. Yeah.
You mean you don't always have to go into the doctor's office, and you can even maybe do it on your phone?
So telemedicine absolutely can be done on your phone. A lot of my patients do telemedicine from their phone. So you don't have to go into the doctor's office. You can make an appointment with your doctor and meet with them this way. So when the pandemic started and the Safer at Home started, there was a big, I think, incentive for people to stay at home as much as possible. So insurance companies and Medicare have been really supportive of doctors using this way to deliver care to their patients. So it's pretty exciting.
So you mean my medical insurance will actually pay for me to have a telehealth visit on my phone?
Yes, your healthcare will actually pay for you to do that right now. And most insurance companies are waiving the copays for it.
Oh, well then, let me call my doctor. But seriously, let me first say this. I've had the telecare with my primary care. I truly have. And the only part I liked about it, I as a patient, I kind of want you to see me, check my stats, you know what I mean? My blood pressure, those things, even though I can do that myself. But the one thing I do like about it, since COVID-19, we all can't be slim like you, Doc. We kind of eat a little more because we get a little depressed. We can't get out, you know what I mean? And we might want another extra potato chip or something we shouldn't have. So I was able to put my slim picture up, while I talk to the doctor. And she said, you put on any weight, because, I was borderline diabetic, but borderline. So, and I was like, no, doctor, you see me, you see how slim I am. But on the serious tip, I didn't know they waived the copay, but I did know this. Before I saw her, I got a call from the office, verifying insurance again and all of those things. So I knew that I was paying for that televisit. I should have asked her for my discount.
Confirm your discount, please.
Yeah, because I'm like, you ain't give me no blood pressure check. You ain't check, you ain't check my oxygen level. You ain't check my weight, thank God. And so we're going to deduct that from the bill. But you know what? With insurance, I'm paying so much for the insurance. Go ahead and charge them, Doc. Charge them. Get your money.
I think the insurance is covering it actually really well. It's been I think it's been one of the only nice things in this experience.
That's what's happening right now. You're right.
Was this. That was it. Something I forgot to mention, I was talking with my receptionist, and she was telling me, did you know that patients thought they had to get undressed for their telemedicine visits? And I just want to say, if anybody's listening, we don't do exams on telemedicine. I have had patients check their blood pressure for birth control refills, so I can give them, their 1-year supply of birth control if their blood pressure is normal. But other than that, we're not doing physical exams during.
So don't get naked. Don't get naked.
Sure, that's just somebody that just wanted to get naked, because everybody know you don't get naked when you go to the doctor's office anyway. You know what I mean? She roll your sleeve up, the nurse do, the doc not even in there first. Take your blood pressure. Y'all just got some freak on the phone, doc. Y'all should have called 911.
This hasn't happened to me. I heard about it on Twitter. My receptionist, and she said that the person thought it was really a real
exam.
Yeah, it's not. It's not. I might have looked at a surgical incision, over the video, but that's it. Nothing.
But that was worthy. It was surgery. I gotta check your incision. You can't come in as best I check that. That's fine. And you're OBGYN. Yeah. Speaking of which, You said you graduated college in 2001?
Medical school, yes.
Medical school, I mean. Yes, let me get that right. Sweetie, you look like you just graduated high school.
Well,
Kindergarten.
thank you. I will
So
take that.
that's a compliment, but I was just going to ask because there are a lot of smart, very brilliant young people, because you see all the time where some skip, not skip, but they're so good they go past high school on into college. You look young.
Well, thank you.
So when you hit 60, you probably going to be hitting about 30. I'm going to be honest with you.
Hopefully.
Yeah.
Hopefully the stress of the situation doesn't.
I should have been a gynecologist. I think it's the babies because they always said children make you young. I know I feel my best when my grandkids are around. Look at all this great doctor. Y'all have some? Are you a gynecologist? I'm sorry.
Dr. Greer?
I'm not the dermatologist.
Yes.
Dr. Greer, I have a question for you. So my question for you, Dr. Greer, is this. I know there's been a lot of great things, what if it's been social media influence, what if it's been influenced via internet. What would you say, in your opinion, are the best ways to boost your immune system during this time?
Good question.
What if it's for your child? What if it's for you? And then from there, what would you also say as well have been some of your personal ways to either keep yourself away from being sick and just keeping yourself healthy during this time?
How do I keep myself from being sick?
Mm-hmm.
If I feel something going on, I try to go to sleep. So getting enough sleep is for me, maybe because I'm lucky, getting enough sleep is really important for me to sustain my immunity in all of us. If anybody's not sleeping well, that's the first thing to try to address. And I'm a, OBGYN. I work with a lot of women. As women get older, they have difficulty sleeping because of their hormones. And I would encourage any woman who's having a difficult time sleeping to discuss it with their doctor so they could address that, because not getting enough sleep will make you sick. For me, I try to eat as many vegetables, and I would encourage everybody to eat as many vegetables as possible. I've been really enthusiastic about my vitamin C intake lately and adequate hydration. You know what is so important I answered the question, for your immunity is exercise.
So it's okay to. Great. That was my question. That was going to be my question. I joke a lot, but don't think I don't take things seriously. It's just in this show, I have to make sure I keep the format going.
Keep it going,
and
yeah.
I have to be me. And
Okay.
I laugh to keep from crying. This is really scary for me. Having heart disease, having these things, and being engulfed in this house when I'm an outgoing person. I would be, if I didn't joke, I really literally would be, Cherie would be visiting me at a mental institution. But I'm stronger than this inside. But the thing about it is, I was walking 3 miles a day. And when I would get out, I went out to go walk and people were coming toward me and things was going on. I got so paranoid. So my doctor said, get out and take some long walks. And I said, but when I wear the mask, I can't breathe. It makes me hyperventilate because I'm not used to wearing it. So I said, so when I tried to walk with it, I had to turn around and come home. I took it off, held my head down and walked home. And I was so hurt and disappointed. And I was like, I can't even do my 3 miles. I've been doing this every day since last summer. And she said, go walk. So what do you suggest? Can I walk without the mask? Because she was like, well, go early in the morning. You don't need the mask. It's not airborne. It's human contact.
Well, I know that we're saying it's not airborne,
Mm-hmm.
but I don't know.
Okay. So
I know right now we're saying it's droplet precautions.
Yes.
So it's passed by droplets. But who knows? What I do know is exercise is important for your immunity.
Okay.
Really important to exercise, not just for your immunity. It's really important for your emotional health. Yes. Which right now is under assault. This is a really, horrible situation that we're under. My grandmother called it a pestilence. She's not wrong.
No, she's right. 100% right. I need to meet grandma. She got a sense of humor too. I like that.
Yeah. So exercising is really important. I like the morning as well, just because there are fewer people. It's also going to be cooler outside in the morning. So I think it just from that standpoint will be a better time to exercise. I think if you can't breathe with the mask on, you need to look for a different kind of mask.
So basically do the mask though. So I'm listening now. So don't not do the mask.
Definitely do the mask. I have a little mask right here. This is, you know, one of the masks you get at the hospital, but I don't know if you can see here. Can you see this?
Yes.
So on the top part of the mask, there's this kind of wiry part.
Okay.
You see that? And the bottom part, it's just, I guess, cotton.
Yeah.
Anyway, if you pinch the wire, can you see here how at the top there's this place where it's pointy? That's because that's where my nose goes. And if I put my nose there, and I'm gonna put down my microphone, and I pull out like this, then when I'm walking, it's not, you know, going in and out like Darth Vader.
Got you.
Vader, and it makes more space. Okay, does that make sense?
It makes perfect sense.
Been wearing masks for a long time, so it's easier for me because I've figured out, you know, how to wear them. But exercising is something I really would not let slide. It really is so important for your
So and that 3 mile walk was always felt just invigorating, and I miss it so much.
Yeah, I would try to return to that. So sleep, vegetables, fruits, exercise, hydration. We live in the desert. Hydration, lots of water, 2 to 3 liters at least a day of water.
Quan, she said water, 2 or 3 liters of water, not wine.
Sorry.
I think you have to like make up for that with more water.
3 liters of water and 1 of wine.
Okay. Hold on. There we go. There's my water right there. See that? Boom.
Yeah. So, you know, maybe drink that 2 or 3 of those a day. That's like 1.5 liter, right?
Yeah, it is like 1.5.
Good job. That's good.
So how many of those a day though, Doc? 1.5. How many of those a day?
So if you're outside and walking for an hour, I would shoot for 2 of those a day of that 1.5. Okay.
So she's giving us everybody, not just us. You're giving everybody. I even want to see if my tech guy got a question because, you know, do you have?
Yes. Since you said, doctor, that you deliver babies, right? So, have you seen any pregnant COVID women, or what would COVID do to the baby? Because COVID's not stopping babies. They might be even making more babies right now, but
they are making more babies, bro.
You made so many excellent points right there. I would, number one, encourage people not to get pregnant right now. If you have some
say it again, Doc. Say that again. Say it again. That's important.
I would encourage people not to get pregnant right now, not until there's some clarity. I don't know if you remember me starting off saying the rules and understanding of this virus change every 2 weeks. I would wait until we know something about this, or at least until we have some idea of what the best treatment is for it, or what is an effective treatment for it. Because remember, right now, we don't really have a treatment. Do you know what I mean? We have like mercy treatments. We don't have real treatments for it.
So you're saying there is no cure at this point, Dr. Gier. Is that what you just said?
That's what I said. There's no cure. You can't take penicillin for this. There's no treatment for this. So this is not a good time to get pregnant. You know, initially, a lot of the information we had about COVID came from China and their experience in China, and that's what made us think that kids couldn't get it. But I think that the quantity of the quality, the depth of information that we were able to get from the Chinese experience is just been inadequate. Anyway, what we know about pregnancy and COVID pretty much still comes from China. And as far as we can tell, pregnant women don't seem to be more at risk from COVID. Although pregnant women usually are at more risk from infections, they are certainly at higher risk from the flu than they are if they're not pregnant. We don't think that babies can get COVID from their mother, but you know, a few weeks ago, we didn't think children could get sick from COVID, so hard to say. Right now, there's a concern that COVID might be in the breast milk, so we don't, if a mother has COVID, we don't want her to breastfeed her child until her COVID is cleared. What else? To my knowledge, have only taken care of one COVID patient. I think universal testing of every pregnant patient has only started recently at one of the hospitals I'm at. In other hospitals, you just don't know who has COVID and who doesn't because so many people who have the coronavirus are asymptomatic. The one patient.
What does that mean, doctor, when you say a lot of people who have COVID are asymptomatic? For the governor of Georgia, please.
Can I get an amen? Let the church.
Amen.
That means that people can carry the virus, pass it along to others, and carry no symptoms. So
will they ever get sick? Because, you know, that sounds similar to HIV. Because there were people that had HIV and never had a symptom, meaning they didn't have, it was like it was two parts of HIV. It was like HIV and then full-blown AIDS. I know that I don't know, but I knew of a guy back home that had HIV. And 3 different girls that he dated died. He probably died a couple of years back, but he lived many years after them. So I say that to say he was asymptomatic, I guess, but they were catching it from him. Yet he didn't, I guess. I don't
He
understand.
was drinking his water, his vegetables, his fruit, and doing exercise.
I mean, I don't want to.
It's mental health.
But why are you the bad influence?
I'm not a bad influence.
But listen, and Doc, here's the thing, and I didn't want to say this, but I am going to ask this because I won't get this. I know that you're busy, so we want you back. We want you back, but I know that you're busy. I want you back. But anyway,
He's coming back.
I felt like I had this back in the end of November, first part of December.
Mm-hmm.
I'm telling you, it was a flu like and I'm years old. It was something like I'm not even smiling, so you know how serious I am. Mm-hmm. And I had this cold and this sickness, and even after I lost my voice, I couldn't taste, I couldn't smell. I started out with a fever and chills. That's how it started. I felt like an elephant was on my chest, and I have heart disease. And it took me first 4 weeks to feel okay. It took another, I started with this at the end of November, didn't get better and get my voice back until the end of January. And there are a few more people around me that said they had it. They felt they had it. Mm-hmm. And I'm telling you, I feel in my spirit and in my soul, I had it.
Well, just be careful because we don't know for certain if you had it. Mm-hmm. You can always contact, I've been doing antibody testing. LabCorp and Quest have antibody tests, which can determine past exposure mm-hmm. to the coronavirus. So you can always ask your doctor for that. So until you have that, I wouldn't say that. Until you have the antibody, I wouldn't say for certain that you had it. But a lot of people aren't going to have symptoms at all. And unfortunately, that's how people get sick, is the people who have no symptoms. It's not like HIV in that you can't really get rid of HIV without medication. Coronavirus will go away on its, it'll either go away or you'll get very sick and not make it. But it's not the same as HIV. So people will have coronavirus and then not have it. Does that make sense?
Yes. It's a difference.
What is the antibody testing, doctor, that you mentioned? And what types of tests are for COVID-19 are there right now, and which ones do you have to go to a doctor for, and which ones do you not have to? If you could just tell us.
Oh, sure. You also mentioned the drive-up as well.
Yes, that was mostly what I was going to mention, that there are places in the city where you can make appointments and go get COVID testing. I believe that that's testing to see if you're actively having the infection. So when there's a swab of your nose or of the back of your throat, that's to check for actual virus material, to see if there are pieces of the virus in your throat or in your nose. So if you actively have it, and if you could sneeze that or cough that on somebody else, or you know, be contagious. The other test, the antibody test, is a blood test to see if you've had it in the past. So the body will make an antibody once you've been exposed to a virus, and we can check for that antibody by doing a blood test. I'd really only recommend blood testing right now for that. That hopefully will change. You know, hopefully we'll one day have saliva antibody testing and urine antibody testing and other types of antibody testing in the future. But right now I'd only recommend the blood testing, and I've been ordering it at LabCorp and Quest.
So you can help us get the antibody testing, which is different than the swab. The swab tells you if you're sick now. The antibody testing tells you if you've ever been exposed to COVID-19. Is that what you're saying, doctor?
Exactly. You said it quite clear. So that antibody test, it tells us, for instance, if you were sick in the beginning of March and you're wondering, was that the coronavirus? You can have an antibody test to see if that was the coronavirus.
Now here's my question there. Now say Cherie Cherie tests and it shows in her antibodies that she had it. What kind of test monkey are they gonna try to make her out to be?
Are they gonna sell? Are they gonna? Am I a Tuskegee in the making?
Henrietta Lackey. You know, we're not being negative. We just want to save many lives.
Black people,
you know.
scared.
But
Scared.
I mean, because I'd rather just go with what you say. I may not have had to take care of myself, keep wearing my mask, drink my water, walk every day, eat my vegetables. Cause see, you test me now, Doc. I'll let you test me. You look trustworthy. I don't think you'll sell nothing. You look trustworthy, so I'll let you test me. But we got to keep it a secret, you know.
So I don't think any of these test results are a secret, and I don't think they should be a secret, because without testing, I don't think our country will ever open up again. Like Disneyland,
Yeah,
we're gonna work normally.
Damn, now you know I got grandkids. Now you're gonna make me go get the antibody test. Why you got to go low? You know I love my children. Do this for the grandkids.
I didn't mean to go low, but until we have a treatment or a vaccine, the only way we're gonna get through this is with testing.
What do you mean?
I have to ask this question. And this is just, and Cherie, this is gonna add to what you're saying. We never been a proponent, as far as African Americans, Black people, a proponent of vaccines. We've seen the vaccine per se, I would say, discrimination when it came to our veterans with Agent Orange, when it came to many other factors of vaccines given to us back in the day that have killed many people. What would be the trustworthy factor in the vaccine coming up versus previous results when it came to flu vaccines, cold vaccines, influenza vaccines, and things that already, like Dion has with heart conditions, and people like myself that have allergies, and other people that have pre-existing conditions already? What would be what would you say is the number one factor in taking the vaccine with all that?
I think, fortunately, we live in a free country. And I think the main factor in whether or not you want to get the vaccine is, hopefully, depending on when it's available, how many types of vaccine, how many different places you can get the vaccine, how many vaccine vials are available. It should just be if you want the vaccine. And this is a really complex question. I don't think I was prepared for it. But I remember when the swine flu happened in 2009, it took a while to get the immunizations. And I feel like at first when the immunizations were available, there weren't that many. So it was really prioritized for people who had other pre-existing medical problems like diabetes, high blood pressure, people who are over the age of 65, and pregnant women. And that's the only reason I'm familiar with that, is because I remember it coming to my office and then like giving it to all the pregnant people. It's my sincere hope that when this immunization is available, it's available in, a sufficient quantity for everybody to be able to get it. I don't know if that answered your question, but I feel like you were asking about the safety of the vaccine. I think
Correct.
that we're just going to have to trust that it's safe and that it's not going to, the FDA won't release it until it is safe.
So can we see a possible like do it yourself at home vaccine kit possibly?
No, there's no vaccine kit like that now.
Right, I know, but there's also there's not as many Black people that trust the government, period. But a lot of people trust themselves. So
Well,
if
the
there
good
was,
news is the vaccine's not probably coming from the government.
but that's the thing. As a Black person, right? It's not that it's not that I have something against the government. I have something against white people. White people are controlling the government. And that is just the way I look at it. And like, I'm not saying I'm not going to take the vaccine, right? I'm just saying that I'm going to be around people who's not going to take the vaccine. So if there was an ability, if people had the ability to do it themselves, like here's the instructions, go ahead, do it yourself. I think people would be more with it to take the vaccine simply because they can see it all the way to the point where they can do it themselves.
I don't know if that will happen. That's a great
Yeah.
That's something worth discussing, but
You glad you did this show, didn't you? You know we was gonna come at you like that.
Poor Dr. Greer, she's already given us more than an hour, guys. So
Now we're gonna get ready to let her go. But the thing about it is, I do want to say this: when it comes to the vaccine, I'm gonna do what I do. I'm gonna clear some things up. Vaccine wise or whatever wise, it's important that we try to be on point to do whatever we need to do to make sure we are here to see more days and brighter days down the road. I understand fear. I have it. And to be African American, you have to have it in this day and time. Basically, for me, I don't want to take anything with 45 in office. I don't. If I have to, I will. That's where you stand on faith and grace and grace and believe in a higher power, as we do as well as when we go to our doctors. Our doctors can only do so much, and then we let God take over. But we go. I'm not so religious. I don't know that I need my doctor or I need medical care. I go first before I enter. If I were going to see Dr. Greer, before I step in your office, Dr. Greer, I've already talked to the man that gave me the life, that's given me life. And I've already asked him to order your steps and your hands and your way. So then I walk into that office, but I'm walking with a shield of him in front of me, so I can better accept everything. And in this day and time, COVID is not playing, is what she's telling you. It has no care about race, color, age, now anything. So we all gonna have to put on the shield, armor, and trust and do what's necessary, because half of the people can't get a vaccine and the other half don't, and we still got people sick. So we're gonna have to figure out a way and push this thing out of our lives. So right now we pray for a cure, and if that cure comes and they start giving people this medicine and it's working, then we're going to have to accept that. And we're going to have to do the best we can, which is try and pray. You know what I mean? As they're even administering it, because it's sad that this is the way we live right now, where people are dying and all over the world. And if there is a hope of a vaccine, people are scared to even take it. What, my God, have we come to? You know, so we have to figure that out. And Dr. Greer, we are so humble and grateful that you took the time to give us, as you see, we're just like anyone else. So many people wish they could talk to someone like you. You're doing, so our questions are not just for us, even if they're crazy. I always tell my children and people that I counsel in different things, there are no crazy questions or stupid questions, just the ones you don't ask because you haven't got the answer to it. You know what I mean? You got to ask. So if we sound far-fetched and far out there, you are just like we are. You are Black, I'm sorry. Had you been white, we would have still said some of the same things, because it's not about white people, it's white supremacy. It's a difference. So I'm not against white people, because I can't be for the world and against. I'm against hate and anyone that will harm someone due to hate. But my point is, we got to figure out how to come together. And if COVID can't bring us together, we're really in trouble.
We really are.
You know, so we got to learn how to trust and hope and figure this thing out together. In some kind of way, white America, you're going to have to talk to Black America. We got to do what we all got to do, Asian, everybody. Because we
Don't forget the brown.
I said everybody, every race.
Everybody.
Because from my understanding, it started in China. That doesn't mean China's the cause of this. COVID doing what COVID doing. No, man, this is COVID. Leave that alone. Right now, we need to figure out how we can all get well and go back to Disneyland. You know what I'm saying? Because I like Small World.
She likes her Small World.
Yeah, that's my favorite ride.
Well, so y'all worry about Disneyland. I worry about the breweries and the bars.
Dr. Gier, Cherie finna give you a good thank you, because I'm so happy that I know Cherie and she brought you to the show, and I'm so happy that you ain't hung up on us because you think we crazy. We really do well, and we are doing well, I promise you. And Cherie, thank you so much, Cherie. For
I just wanted to invite Dr. Gier to give us some last little drops of wisdom about how we can all, whatever party we are, whatever race, support healthcare professionals such as yourself, number one. And two, how can we keep everybody safe? If you could just remind us of the little that we do know about protecting ourselves. We saw that you showed up with your mask. So talk to us about that, Dr. Gier.
You definitely showed up with it.
I think right now, all we can do is our best to follow the leadership, that's available to us, which right now is going to be coming from our mayors and our governor. And we're very lucky to, I think, live in California, where the priority really seems to be, our health. So certainly I would strongly encourage you wear a mask. If you have a mask that doesn't fit well, I'd work on finding a mask that does fit well. They don't have to make you feel like you're suffocating.
One quick question. So I would never ask I gotta ask this. I'm in the store and I got my mask all up here.
If it's under your nose.
Say it again. Wait, Doc. I know you're tired of me doing this, but see, when you say that to people, they get offended. So you got something behind you I don't have. It's called MD.
It works like this. It doesn't work like this.
Okay.
It works like this.
Over.
I'm gonna have Mike do that retake 15 times. Mike, you're gonna see that like a little remix. It works like this, not like this. What? We're gonna do a remix because they really getting it wrong. And I'm talking about I walked in one time hungry, didn't want to cook. And I walked in the restaurant, because you can order, and take out. And one of the guys had the thing here. I said, well, I'll be cooking at home.
Oh, Lord. Or when you go to the grocery store and they got little stickers on the floor that say stay 6 feet, and people keep coming up on your butt target. Now, fool, get away from me. Don't you see I'm trying to be safe?
Whew. Doc, you are a great person. All doctors, all healthcare professions. I praise everybody, but especially you guys, because you still have to deliver babies. It's not going to stop. You know what I mean? You still have to be there with the patients that are there. And, we're here. It's easy for us to talk, but you and the people around you are putting your lives on the line day after day after day after day. And we thank you and we salute all of you.
Well, we always do that. Just now the threat is bigger than usual. So thank you for saying that.
Right,
Thank you so much for being here, and we're going to say goodbye to Dr. Gier, because I know.
Bye, Dr. Gier.
Such a good time. You guys are so fun. Thank you.
I'm going to take my walk now, Doc.
Okay, enjoy.
All right.
Right, don't forget your water.
I'm not. I'm going to get my wine and my water.
Gin and juice. Oh, wait a minute. Wine and water. Wine and water.
Nah, he say I don't really mind you crazy, baby. Oh, a little fire's alright with me. Oh, sometimes we even end up debating. Lately, it's cool, cause he likes the way his baby thinks. Air blowing in the wind as I ride, I recline while I vibe down the 10. Exit bus right back on Crenshaw again.